Hi, everyone. We thank you for attending the Albany Stratton VA Medical Center's Women's Health Public Forum. My name is Emily DeSalvo. I am the Women Veterans Program Manager, and I'll be moderating our public forum tonight. I'm extremely grateful for this opportunity to support a very special population, our women veterans. By history, VA healthcare services were mainly geared toward male veterans, but this has changed and continues to change. This public forum is one example of the developments to ensure that women veterans are both aware of the services available to them and to give a platform for you to have a voice, share your feedback, and ask questions. So some quick housekeeping items during this event. If you have a question, press *3 on your phone and you'll be placed in a queue to ask your question. If our screeners do not get to your question, you can remain on the line at the conclusion of the presentation and you'll be able to leave a message. Questions will be answered at the end, and I apologize in advance if we're unable to get to all of them tonight. You are also always welcome to call me at 518-626-5519 at a later date if you think of a question and didn't have an opportunity to ask it tonight. Again, that's 626-5519. If you are on your cell phone and would like to receive a live link that will allow you to follow along with the presentation slideshow, press *8 and click into the link provided. Otherwise, feel free to remain on the phone and listen along. Please also be aware that we have several polling questions throughout the presentation where I will pause and ask you periodically for the polling questions, and you can log your responses using your phone. These questions will be helpful to us as we continue to develop women's health services at Stratton VA Healthcare System. We do have a full agenda with presenters to highlight services being offered through the Albany Stratton VA. I may have been a bit overzealous with how much we can cover in just an hour, but we were so excited for us to share as much as possible. So just a quick review of our agenda for tonight. In moments, I'll be handing over the realm to our Chief of Staff, Dr. Howard, for opening remarks, followed by Sean Tuckey discussing the PACT Act, then Dr. Mezzador, Women's Health Medical Director, discussing primary care and gynecology services, followed by Sabrina Durhammer, our pelvic floor physical therapy, highlighting those new services, Zoe Kazepis, our women's health primary care social worker, followed by Dr. Ruben Pareto-Wendy, a rheumatologist with our VA, and also Afifa Barone, who's our women's health primary care mental health integrated social worker. And then lastly, we have Deborah Barnes, our peer support specialist, and the remaining time at the end will be our question and answer opportunity. So without further ado, I am honored to introduce to you the Chief of Staff of the Stratton VA, Dr. Howard. Thank you, Dr. Howard, for joining us tonight.
Hi, Emily. Thank you for giving me this opportunity. Just as a sound check, can you hear me okay?
I believe we can. I can hear you.
Okay. Sometimes with these electronic things, I talk to the wind for a couple of minutes before I figure out that I'm not really in the conversation. On behalf of Stratton VA and the director, Darlene Delancey, I want to welcome everybody to this forum. It's a wonderful opportunity for both education of our listeners, but also for us to learn from our listeners their concerns as well. So I appreciate Emily and the entire team putting this together. I wanted to share some thoughts with you just as we come into this. In this setting, usually what happens is that the public affairs officer gives me some talking points, and they're usually very bland and generic, like the VA will provide some sort of services to 1 million women nationally this year. If you figure in healthcare, the GI Bill, home loans, and compensation or pensions. 30% of all new veterans enrolled in the VA currently are women, and nationally there are about almost 1 million women enrolled in VA healthcare. Albany Stratton serves about 3,300 women veterans annually and you're going to hear a lot about the various services that are presented or offered tonight. But I'd like to just put some perspective on it from a personal point of view, that this is not news. I think anyone who has really worked with the VA and with women veterans has known for a long time that there are women in the military, there are women veterans, and we need to care for them. What has changed is the recognition on a national level of the need for funding and expanded programming, and especially the need for listening to the women veterans to make sure that they get what they think is appropriate care for themselves. The personal thing I wanted to share with you is that I am a Navy veteran myself, and I served on board the USS Samuel Gompers from 1978 to 79 as the ship's medical officer and as the medical officer for Com Crew Des Crew 3, which is the Pacific Nuclear Fleet Command Group. In that context, there was a program that began in 1978, extending into 1979, called WINS, W-I-N-S. And for any of the women veterans here, you may know of that program. It stood for Women in Navy Ships. And up until 1978, by law, women could not serve on board ships in the Navy. But that changed in 1978, and the USS Samuel Gompers was the first ship in the Navy to receive women sailors. And in fact, my replacement the following year as the ship's medical officer was the first woman serving as a medical officer on a U.S. Navy ship. So that we had to, during my time on that ship, retrofit the medical spaces, think hard about what services were different and how they needed to be delivered differently, and then resupply ourselves, retrain ourselves, and reorient ourselves to the fact that the other 51% of the population was going to start serving on board Navy ships. Fast forward then to my first experience at the Stratton VA. I came to the Stratton VA in 2010 as a general surgeon. I was not part of the administration at that time. And I thought I was coming to the VA where we took care of mostly men. So imagine my surprise when my first patient that I saw, my first day in clinic, was a woman in her late 20s, single mom, who had bilateral below-the-knee amputations from an IED explosion in Iraq as she was driving a truck in a combat zone. My first operation here at the Stratton VA was on a 47-year-old woman who had breast cancer, on whom we did a mastectomy with an immediate plastic surgery reconstruction for her breast cancer. Pretty loud and clear message to me that women were part of the group of people we needed to care for, and that they were an important group that needed additional services within the VA. My predecessor as chief of surgery at that time, Dr. James Dolph, led the way in that conversation by recruiting and hiring a full-time gynecologist to work at the Stratton VA, which was the first time there had been that service available. And you're going to hear from her tonight, Dr. Mesidor. And Stratton has grown and built on those beginnings ever since. So I would give real credit to Dr. Mesidor for building that program over the years, and to Dr. Dolph for having the foresight to engage in that kind of effort long before it became part of the national VA conversation. So with that perspective and that information, I welcome all of you to this forum, And I hope that you have a good time tonight listening, learning, and letting us learn from you.
Thank you, Dr. Howard. That was a wonderful opening, and what an honor to hear your stories. Thank you for sharing that with us. And it's an honor to work alongside you. And so next up, we have Sean Tuckey, who is a health science specialist with the Director's Office, who will be talking about the PACT Act. Sean?
Emily, can you hear me?
Yes, I can.
Okay, good. Thank you. I was just talking to myself. I accidentally muted myself when I unmuted myself. Thank you, everybody, for calling in and joining us. I'm going to take a few minutes to talk about the PACT Act. Like Dr. Howard, I am also a veteran, and this topic is near and dear to my heart because it's something that's directly related to me and global war and terrorism veterans. In another life, I served in the Marines, and I deployed to Iraq in 2003. So this new law, it was just signed into law less than 2 weeks ago, is the PACT Act. It's named after Sergeant First Class Heath Robinson. The acronym is Promise to Address Comprehensive Toxics, or PACT Act. The big thing with the PACT Act is it's going to expand eligibility and expand presumptive illnesses over the next, over the course of the next 10 years. The big thing off the top is if you know a Vietnam veteran who, let's say, for example, served in Vietnam in 1968, 1969, 1970, and they came to the VA once in the early 80s or the mid 80s, they're probably eligible for care again. They should, if you know a veteran, you should have them come in and meet with us and re-register, because the fact that they served in Vietnam and had boots on the ground, they're at least eligible for a rescreening for toxic and environmental exposures. And same with Gulf War veterans and global war and terrorism veterans. Essentially what the PACT Act is doing is re-expanding or reopening the eligibility windows for veterans when they first left the service. So for example, when I left the service in 2003, the VA, I was eligible for free health care through the VA for the first 2 years, and then after that it's based on my income or if I have service-related injuries. This is it reopens that window and expands it for veterans. It does a lot of other things in terms of presumptive illnesses for veterans from Vietnam, the first Gulf War, and then global war and terrorism. And that will kick in each year. There's different components of it that will be added to the exam. The other thing it will do for veterans is with the PACT Act, every veteran who comes in for primary care will get at least a one-time screening, and then every 5-year follow-up screening. It will also expand research for veterans in terms of if we think environmental exposures lead to X, Y, or Z, it will expand research opportunities to see if environmental exposures lead to X, Y, or Z. It will also increase training for staff, and it will also help with expanding research facilities, such as we're lucky here in New York that in New Jersey there's a war-related injuries and illness research center, so it will strengthen those bonds. And I will hang on at the end, and if there's any questions, I'll be glad to try and answer them for you.
Thank you so much, Sean. I appreciate you talking about the PACT Act with us tonight. And next up, we're going to take a brief pause for our first polling question. And I'll read the question 2 times with the responses you can enter into your keypad on your phone. So the first polling question, again, this will help us continue to develop our healthcare services. So the first polling question, which areas of your VA healthcare experience would you like to see greater improvement on? Dial 1 for access to healthcare, 2, communication with your providers, 3, care coordination, 4, telehealth options. Again, I'll read that. Which areas of your VA healthcare experience would you like to see greater improvement on? Dial 1 for access to healthcare, dial 2, communication with your providers, dial 3, care coordination, or 4 for telehealth options. And your polling questions will continue to be tabulated and entered, but we will move on to our next presenter. We have Dr. Suzanne Mesidor, Women's Health Medical Director, and our full-time gynecologist, first gynecologist that Dr. Howard had mentioned before. Dr. Mesidor, are you on?
Yes, I'm on, Emily. Thank
you.
And thank you, Emily. Thank you to our Chief of Staff, Dr. Howard, for his support and for the leadership in supporting our Women's Health Program. Good afternoon, everyone. I'm Dr. Mesidor, full-time gynecologist at the VA. I would like to welcome you to our Women's Health Public Forum, and thank you for taking the time to listen in and explore all the wonderful myriad of preventative medical and specialty health clinics and mental health and social services that we have here for our women veterans. I sincerely hope that you'll find this session informative. With regards to primary care services for women, we stress the importance of preventative care and offer many screening exams such as blood pressure, colorectal screening, cholesterol screenings, depression screenings, and of course PAPs, mammograms, and bone density scans. We also offer immunizations such as a flu shot, pneumonia vaccine, tetanus, pertussis, booster, HPV, the zoster vaccine, and COVID vaccine. There are multiple providers who are involved in your care, including physicians and nurse practitioners who provide comprehensive medical care and specialized care at the Albany VA and at the outlying VA clinics. And once you are joined here, once you are signed up to receive care here, you'll be assigned to a primary care provider and will be referred to specialists as needed. So I'm going to list a bunch of specialty clinics just to showcase the breadth of services we provide here. And such specialty care includes gynecology, cardiology, immunology, allergy, neurology, endocrinology, hematology, oncology, urology, general surgery, podiatry, dental health, behavioral health, social workers, and physical therapists. So, that is just to list a few. And for the specialty women's health services, we include services that involve screening for cervical and breast cancer screenings, contraception care, sexually transmitted infection screening and treatments, evaluation and treatments of female infertility, menopausal conditions, ovarian cysts, uterine fibroids, polycystic ovarian syndrome, and GYN surgeries if needed, of course. And we have a comprehensive mental health department that cares for veterans with illnesses that include such things as depression, anxiety, post-traumatic stress disorder, military sexual trauma, and substance abuse recovery. We want to welcome you to the Women's Health Department and encourage you to sign up and take advantage of all the services that we provide. We're happy to showcase the breadth of services we provide to our female veterans, and the majority of our female veterans are extremely happy with the care and personalized care and attention that they get. So thank you very much for dialing in and for listening in. And we want to thank all our support staff and the Women's Veterans Program Manager, Emily, who do all the work, a lot of our work, and also our leadership, the Stratton's Director, Assistant Director, Chief of Staff, and Nurse Administrator. Thank you very much. Have a good evening.
Thank you, Dr. Mesidor. It certainly is a great team effort. And next up, we have Sabrina Durhammer, who is our pelvic floor physical therapist. Sabrina, if you're on.
Good evening, everybody. My name is Sabrina. I am the pelvic floor physical therapist at the VA Center in Albany, and I did just start working there just recently. I believe I started seeing clients in December. I myself, I'm also a veteran and currently serving in the Army Reserves as well. So I do have an understanding of veterans and maybe some experiences that you have been through. Emily, if you could click on the next slide, please. So to get started here, a lot of women in general, not even just veterans, but many women in general have never even heard of pelvic floor physical therapy. So just want to briefly go over what it is and what makes me qualified to perform this service for individuals. Pelvic floor physical therapy is a part of physical therapy, and we obviously work with the pelvic floor, and we address problems that deal with bladder, bowel, sexual function, pelvic pain, and sometimes even going into lower back pain. What makes us qualified to perform these services are continuing education courses. So we do have our physical therapy license for the state. And then to learn how to do certain assessments on individuals, we do have to learn to palpate those muscles, and those are continuing education courses. The continuing education courses include things such as external palpation of pelvic floor muscles and also internal palpation of these pelvic floor muscles, during which time we assess the structure, the strength, and function of the muscle and how it relates to symptoms on the bladder, bowel, sexual function, and even pain. If you could click the next slide, please. So some of the symptoms that we do help with, as listed on the slide, when it comes to bladder symptoms, many women do find that they have some of these symptoms, and yet we're told that they're normal and it's just everyday life, especially if we have children or have done a lot of heavy lifting in our past. Some of these symptoms are urinary leakage, frequency, things like incomplete bladder emptying, retention of urine. Those are just to name a few. But I am here to let you know that although we have maybe possibly had children in the past, or we have been lifting or doing extra things in the past, although it is common to have leakage, or when we cough and sneeze or run and jump, that does not mean we're supposed to have leakage when that happens. So if you are experiencing these things, make sure you tell your provider and ask about pelvic floor physical therapy, because we do help in those aspects. We also help with some bowel symptoms, which includes things like possible fecal leakage or even gas leakage. If you can't control gas, that is a type of incontinence, actually. Urgency. If you are constipated or have a lot of constipation, that is something we deal with as well. A lot of individuals are also diagnosed with IBS, and this is something that we can help out with. Now, for things such as like IBS, it's not that we're taking away that diagnosis. However, we can help you manage the symptoms. If you can, please click on the next slide. Moving on, we also help with pelvic pain. So pelvic pain can include many things, all the way from tailbone pain to painful intercourse. We do have, again, the continuing education courses that we take give us different tools to use with the individual to help relieve some of these pain or actually help you to at least be able to control it in some ways and reduce the pain. We also deal with male patients. However, at the VA hospital right now at Albany, we do not see male patients. We only see female patients at this time. But if you know anybody who is a male that experiences any kind of pain, we are open to community care as well. Another thing we another thing we do help with is sexual dysfunction, which includes, painful intercourse or pain with penetration and difficulty achieving orgasms. Okay, so these are all things that we can help with as a pelvic floor physical therapist. If you could click on the next slide, please. So the next thing I want to address is, okay, so these are things that pelvic floor physical therapy can help with, but what is happening during the actual assessment, or what does it include? So during a pelvic floor physical therapy assessment, so your first appointment, if you do come to see me, these are the things that we include. One, we do I do a very thorough list and subjective measures. I ask you a lot of questions, and I will ask you for a personal history of the symptoms that you're experiencing. We do really dive in deep because it all gives me puzzle pieces and gives me clues as to what's going on and what direction we need to drive our therapy in the future. Next, I will do objective measurements. Now, depending on your symptoms, depends on what kind of objective measurements we do. Now, this can include anything from an orthopedic screening, meaning like movement of the spine, movement of the hips, strength and length of range of motion. I will also possibly assess your breathing and whether or not you can breathe into the stomach or not. I will be palpating on the stomach to see if I feel any masses. I then typically do an external or internal pelvic floor assessment. Now, prior to doing this, I always ask all my veterans, all my patients, whether or not they're even comfortable with this part of the assessment. And at that time, if you're not comfortable with this assessment, you just let me know and we will not go that direction. The point of the assessment is not to make anybody uncomfortable, but to make you comfortable. And the great thing about physical therapy is that we can always go a different route. So that is okay, and you just let us know. The rest of it is the assessment part. So that's the write-up, which I will then tell your provider who referred you to me, and a plan of care. So the plan of care is basically telling you what our plan is for the future and how we are going to drive our treatment sessions. Next slide, please. So in the following sessions that we will have, I typically, and not always, but typically we do usually start with 5 treatment sessions once a week. That will vary on the severity of symptoms. Sometimes we need less, sometimes we need more. However, it will always be worked with you. I am only at this time available on Mondays, and some individuals are too far away to even come to the VA medical center, but we do also do referrals to community care, and I do have virtual health available as well for some individuals. But what to expect during treatment sessions? Really, this is going to depend on what your symptoms are and what dysfunction we found during our initial evaluation. But as you can see during treatment sessions, some of the things that we can work on is coordination of that pelvic floor. When and where should we be contracted? When and where do we release? And do you have control over that? I also do a lot of manual therapy, a lot of massage techniques to help relieve myofascial restrictions and trigger points in the muscles. We do work on strengthening. Biofeedback is a technology that we use that actually sends a signal to my machine and tells me if you're using those muscles correctly or not, and it also gives you a visual cue. We will possibly go over water and fiber intake to help relieve some symptoms and make things more regular. And we can also use things such as muscular re-education. Again, it really depends on what the symptoms are and what direction we need to go in. Now, as I stated before, as physical therapists, we look at muscle structure and the function. And the 5 functions of the pelvic floor muscle are support of our upper body weight and from ground force reactions. It's sphincter control, so that has to do, with bowel movements and leakage. Another function is sexual. Stability of our actual pelvis, the bone structure of the pelvis. It helps hold everything together with our ligaments. And then also a sump pump action, which deals with the movement of lymph through the system and the working with the diaphragm. So as I mentioned before, at this time, we do not see male patients. If you see any male patients, they will be sent out to community care. However, there are a lot of good services nearby in community care for male veterans as well. And for females that are outside a certain mile radius, if you are not able to make it to the actual Albany Stratton VA Medical Center, there are community services out there as well. So please don't forget, if you're experiencing any symptoms that you may be things that you thought were typical, please mention them to your primary, and then definitely ask for a referral to pelvic floor physical therapy, and we may be able to help you out. I want to thank you all again for phoning in, and that concludes my brief. So go ahead, and Emily, you can take over from there.
Thank you, Sabrina. It's been a pleasure working with you and having you on the team. Thank you for presenting tonight. Okay, we're going to take a quick poll question. So poll question number 2, and I'll read it 2 times. In the last 6 months, did anyone in your VA healthcare team talk with you about specific goals for your health? Dial 1 for yes, 2 for no. Again, in the last 6 months, did anyone in your VA healthcare team talk with you about specific goals for your health? Dial 1 for yes, 2 for no. And just to remind anyone, if you are on your phone, you can press star 3 to ask any questions that we're holding for the end. Again, star 3 for questions. And if you are on your cell phone, star 8 will send you a live link. So if you want to follow along with the slides through that live link, press star 8 to have that texted to you. And just a quick note for anyone who is following along with the live link slides, you may need to refresh your page if the slides are not moving forward for you, as they are going forward. So if you're noticing that they're not, please try refreshing your page and see if that helps. Okay, so next up, to keep things moving, we have Zoe Kazepis, who is our Women's Health Primary Care Social Worker. Zoe?
Hello, everyone. This is Zoe. So I'm the PAC social worker for all female veterans within the medical facility as well as the CBOCs. I fall under medical social work. I offer case management services as well as connection to various resources regarding any psychosocial issues you may experience. Those include financial concerns, housing, relationship concerns. Really, I welcome any and all questions from any vet. I can't promise to have the answer, but I can point you in the right direction at the very least. I'm pretty much keeping it short and sweet, so you can contact me directly with the number on the slide or ask your provider for a consult. We're very happy that you all attended this meeting to hear the services that we're able to offer you and so that we can get feedback from you.
Thank you, Zoe. Okay, next up we have Dr. Ruben Pareto-Wendy, a rheumatologist with our Stratton VA. Dr. Pareto-Wendy?
Hello, can you hear me?
Yes, we can.
Test. Oh, thank you. Yeah, good afternoon. I'm Ruben Pareto, rheumatologist for over 20 years. I would say 19, 20 years, and graduated from Puerto Rico. And I have been at the VA already for over a year, and I'm very happy to have time to take care of patients. And lo and behold, this is possibly one of the best scenarios to work with at. For you to know, rheumatology is a specialty in internal medicine that deals with, of course, arthritis, but also we deal with other conditions, other diseases. Some of them are really unknown or unfamiliar, and some of them, they are life-threatening. And 2/3 of them are women. And sometimes we say, oh, men have higher risk to die overall, but in cases of rheumatology, it's a little bit different. In my first slide, you might see women are very vulnerable for any rheumatic disease, and except ankylosing spondylitis, which is arthritis of the spine, and gout. Our gout and osteoarthritis, I would say, is equivalent, and perhaps more in women who, are in the 50s. And please, next slide. So my talk was focused today to let you know that we are offering services not only for osteoarthritis and inflammatory arthritis or crystal-induced arthritis, but also for other diseases. Next slide, please. Okay, thank you. As you know, lupus is a systemic illness, and it's more frequent in women. The immune system attacks the own body, and especially the skin and joints, but it can start with other organs. And the key thing here is to make the diagnosis early and approach the appropriate therapy. Most vulnerable people are women in childbearing age, but I've seen patients, of course, children not here, but elderly patients, even in the 70s, who had an onset of disease, a very bad onset, and we had to take care of them. So why the butterfly? So butterfly is because, can I have the next slide, please? Because in the face, in the cheeks, there's a butterfly figure image. So people who have a butterfly rash, they might have lupus. In the next slide, we will see this a little bit better. And anyway, lupus comes from the Latin, which means wolf. And in other words, in the past, people thought this was a wolf curse or some curse because of the face had some lesions too, but it's not. The immune system is attacking the skin. Similarly to the skin, there are internal organs affected, and especially the kidneys. And if we take care of the patients promptly, we can keep the kidneys being active and working. And so can I have the next slide, please? Okay, thank you. Yeah, and our goal is to see what we can do to identify the disease. Many providers, they send the patients to us for a positive marker in blood, which is the famous ANA. But we don't need to wait for this. Sometimes fatigue is one of the main symptoms, irritability, joint pain, weight loss, and so on, things that are very unfamiliar, uncommon. And sometimes lupus can present during the pregnancies, and that's the right moment to see a rheumatologist. And so what we do is to define the possible target organs, treat the diseases themselves, prevent the damage, and counsel patients, of course. And how do we prevent? Is by advising patients to do this, and especially avoiding, for example, sun exposure or triggers that aggravate lupus, and so on. Next slide.
Daddy, is it where the snack?
Just a minute. Next slide, please. Okay, next slide, please. Regarding the other diseases I wanted to talk about briefly is inflammatory arthritis. Inflammatory arthritis it's something unusual, but affects more women. And it's not only rheumatoid arthritis, there are multiple. We see more than 200 types of arthritis. And ideally for a patient is to see us once we identify the problem. Sometimes the picture I'm showing here is of a patient who had inflammatory bowel disease. Of course, this patient was unintended, and we made the diagnosis through the arthritis. And this was amazing because after we saw her, immediately after we started the treatment, she did better. She was able to walk after maybe 2 years. So next slide, please. Next slide, please. What I wanted to talk about, and especially in this setting, is occasionally patients have only fatigue. And sometimes we are unaware of, but we start getting the dry eyes, dry mouth. Sometimes it's overwhelming, and we need eye drops, artificial tears, and so on. And this is the famous Sjogren's syndrome. Sjogren's syndrome is an autoimmune inflammatory disease. The target organ are the salivary glands, the lacrimal glands, and we end up having a severe dry mouth and dry eyes. That's why it's very difficult for us to identify patients with this problem, but occasionally they might have other problems, especially inflammatory arthritis. And as if you see the slide, the person who is there, she has a swollen parotid gland, and this is because there's inflammation there. Most of the symptoms are fatigue, joint pain, and muscle aches, and the dryness, severe dryness. But also other patients, they have other organ involvement like the muscles, the joints, lungs, and occasionally we see other problems like neuropathy. So it's a question of screening patients as much as we could. And it would be wonderful if you could come to see us to do this activity. Next slide, please. And finally, what I wanted to mention briefly is about fibromyalgia. Fatigue, overwhelming pain, a foggy mind are the hallmarks of this disorder, and especially women. But sometimes we see patients who have not only fibromyalgia, they might have something else underneath. Many patients with Sjogren's syndrome, for example, they have fibromyalgia. Many patients with rheumatoid arthritis or lupus, they might have fibromyalgia as well. Many patients with other conditions, they might have other problems like, for example, celiac, and so on. It is associated with this chronic pain. Patients are unable to sleep, so that we focus on the sleep. And the beauty of the VA is that we are offering now martial arts, not Tai Chi. This is Qigong, which is similar. But this is a really good option for people who have this chronic pain to go through from the non-pharmacologic perspective. So there are two types of therapies. We recommend medications, but also we advocate for lifestyle changes if possible. Sleeping longer, refreshing better, biofeedback, doing this Qigong martial art, some light exercises, and so on. This will help. And sometimes it's important for us to screen patients who have anything underneath. The patient I was talking about is a patient who had a bone disease. She was losing phosphorus in the urine, phosphate. And when you lose phosphate, you start hurting terribly. And this is bone pain, not fibromyalgia. And again, if we do not know this, we will say, oh, fibromyalgia, and we label patients like this. And I don't like doing this. So I prefer seeing the patient, advising what to do, and then from there on, everyone is on board. So possibly you might have tons of questions, and you are welcome to go ahead. Thank you, Emily, for the kind invitation to let me talk today.
Thank you, Pareto. Dr. Pareto, we certainly appreciate your enthusiasm with making sure women have, proper screening for all these autoimmune diseases. And thank you so much for taking the time tonight. And so next up, we are going to pause for poll question number 3. Again, I will read it 2 times. And the question is, compared to a year ago, how satisfied are you presently with your VA healthcare experience? Press 1 for more satisfied, 2 for about the same, 3 less satisfied. So again, compared to a year ago, how satisfied are you presently with your VA healthcare experience? Dial 1 for more satisfied, 2 about the same, 3 less satisfied. And so while they are collecting your poll questions, again, these questions certainly help to gauge how we're doing and areas that we can continue to develop further. So our next presenter, we have Afifa Barone, who is a social worker with our primary care mental health integration team. Afifa?
Thank you, Emily, and hello to all. My name is Afifa Barone, and I'm a licensed clinical social worker embedded within the Women's Health Team as a member of primary care mental health integration. My previous work includes working with military women and men overseas in Afghanistan and Iraq, deployed as a DoD consultant in combat zones as part of Operation Enduring Freedom, as well as Operation Iraqi Freedom. I have also worked with the U.S. military in Guantanamo Bay, Cuba, or Gitmo. My previous work here at the Albany VA includes working in the mental health crisis clinic in the ER, as well as on 10B, the inpatient psychiatric unit. In addition, I've completed my training and internship here at this VA on the 10A outpatient behavioral health clinic. What I do within women's health, I'm the behavioral health consultant for the clinic. I work with primary care providers in situations where good health care involves paying attention to physical health, habits, patterns, behaviors, emotional health, and how those things interact with each other. My role within PCMHI concentrates on how the patient's presenting problems impacts their daily functions, such as sleep, work, interpersonal relationships, family, friends, recreation, physical and medical conditions, as well as substance use. Veterans can contact me through my direct office phone number, which is 518-626-5541, or by contacting the Women's Health Team at 518-626-6140. Thank you for your time, and it is a privilege to serve you.
Thank you so much, Afifa. I certainly appreciate you hopping on to present and being a part of the team. It's been an absolute pleasure, and thank you for sharing your past experience as well. We certainly treasure that as well. And next up, we have Deborah Barnes, who is our peer support specialist. Deb?
Can you hear me?
Yes, we can.
Can you hear me? Okay. I'm Deborah Barnes, peer support. I'm also a U.S. Army veteran. I work in the homeless care for veterans and CWTs. And we do a lot with military benefits assistance, one-on-one services to aid both in and outside the VA, partner with the Homeless Veterans Program to aid with housing, offer options for participation within food pantries both in and out of the VA. With veterans with volunteer services available to provide guidance with the whole health group, conducting support meetings, developing recovery strategies, and responding to patients' emergency as needed. I'm on the 10th floor, 1026 Delta, and my phone number is 518-626-6243, or my cell is 518-596-9939. And if I can't find out the answer, if I don't know the answer, I'll find it out and help you. So that is it.
Thank you, Deb.
Thank you.
In my time with the VA, working with peer supports has been such an integral part in what we do. So thank you to everything that you do for our VA and the women that we serve. So we have our last poll question before we move into our question answer portion. So the last poll question, again, I'll ask 2 times. We would like to develop a women's health newsletter. How would you prefer to receive it? Dial 1 for email, 2 through United States Postal Service, or 3 through social media such as Facebook. So again, that last poll question, we would like to develop a women's health newsletter. How would you prefer to receive this newsletter? Dial 1 for email, 2 through USPS mail, or 3 through social media such as Facebook. Okay, so please feel free to show us what your response is so we can know how to move forward with that. And we'll move into question and answers. One question that came in, Dr. Mesidor had actually asked me for one of her vets, was asking how she can be referred to Qigong. So, and Dr. Pareto had mentioned Qigong. So we have, I run a women's health Qigong group on Monday mornings, every Monday at 11 a.m. I also have a Qigong group for both men and women on Thursdays at 1 p.m. And we also have one of our recreation therapists, who runs a Qigong group for both men and women Mondays at 9 a.m. So if you are interested in Qigong, you certainly can give me a call, and I can, talk a little bit more about what Qigong is. And it's gentle, mindful movements. As Dr. Pareto had mentioned, it is good for anyone who has arthritis. And it's also, nice to rest our mind as well. So gentle, mindful movements. But please give me a call if you're interested in talking about it. It's my number is 518-626-5519. Again, 626-5519. So we'll move into some more questions. And one of them that came through is from Andrea, who is in Saugerties. Andrea was asking, how do you qualify for dental benefits? And so dental benefits certainly is a tricky one. And for qualifications with dental benefits, I always certainly encourage people to talk with our business office, but dental benefits generally, eligibility is determined if you have suffered a dental injury from service or are 100% service connected. And if anyone else, Sean or anyone who's on the line, has anything to add to that, please feel free to unmute yourself. If I misspoke or you have anything, the business office is 518-626-6746, and that is the best contact to talk about any of your eligibility benefits, healthcare benefits. Okay, another question that we had come in from Linda is, she's commenting on the availability of mammograms and when will that change? And so yes, unfortunately, so our mammograms are on pause right now for our facility. So we have gone through staffing changes from retirement. So we've hired on a new staff person who's Marissa. She is absolutely wonderful. And so we're going through the reaccreditation process with that. And we are also anticipating a new mammogram machine coming in as well. So a lot of steps to make sure that everything is proper and in place, so that way we can provide the best mammograms that we can. And I know that we prior had a wonderful mammogram system, and we anticipate that is coming in the very near future, again, to be fully up and running. And so if you are due for your mammogram, please talk with your primary care provider, and they can put in a community care consult for you. Okay. Let's see, there was another question. Dr. Mesidor, if you are on still, this question comes in from Rita. Is the VA going to issue female Viagra?
Hi, Emily. Thank you for your question. It turns out that there are actually some new and exciting treatments that the FDA, the Federal Drug Administration, approved for women, both premenopausal and postmenopausal, with hyposexual disorder. And it turns out that these medicines are brand new on the market, and we don't know of any long-term side effects. They have not been established as yet. But these are anything that's FDA approved and is especially in this case that's needed for a lot of women have been asking about it. We usually have to go through the pharmacy approval process at the VA, and where it can be gotten for them. But these medications are available to one to premenopausal women and one to postmenopausal women. And in order to qualify for this medication, the drug manufacturer has listed specific ways that people should qualify for this type of medicine that they have out there. So it is something that we will be looking into getting for our women. However, I have heard reports, and there are written reports on women trying the male prescribed Viagra pill that's been out, but that's not really satisfactory for most women who use it, and it's really not indicated for women's hyposexual disorder. So that is something that they can even put in for a phone consult with their primary care or with me with GYN, and we'd certainly be willing to chat them through the whole process. Thank you, Emily.
Thank you, Dr. Mezzador. Okay, and we have another question that came in online from Pat. Is physical therapy available for those who live hours away from Albany? So certainly talk with your primary care team. That's going to be your point of contact with that, so that way they can put in a community care consult for you if you are not within a drive time eligibility from the main facility. So always talk with your primary care team if you need physical therapy, so they can put in that consult for you. And we have another question from Elisa. I apologize if I'm mispronouncing that. And she is asking, how can I schedule an evaluation with pelvic floor physical therapy, and can this be done via telehealth? And so, Sabrina, I'm not sure if you're still on. Feel free to hop in, but scheduling with Sabrina for pelvic floor physical therapy, you can certainly call the Women's Health Clinic.
Sure, Emily, I'm here.
Go ahead.
If you'd like me to talk about it a little bit. Okay, so this is Sabrina. I'm the pelvic floor physical therapist. So what we typically like to see is, one, that your primary care manager sends a referral to pelvic floor physical therapy. I do accept, right now I'm the only one in the clinic doing it, so I do accept virtual consults. However, I will say that once I do the virtual consult and we really go over the symptoms and see what's going on, it is typically beneficial to at least do 1 or 2 face-to-face appointments so I can really assess the pelvic floor muscles. However, I do understand if you're coming from several hours away, there's community care services out there, but it may not be available in your area. So we can do a virtual appointment to do the assessment. Again, I don't need to always do a pelvic floor assessment per se, but after talking to you and doing the initial evaluation, if I find that it would be beneficial to do a hands-on, I may ask you to come in for at least 1 appointment, and then maybe virtual after that as well. So it is a possibility, and we can pretty much take it as it comes. I hope that answered your question. Go ahead, Emily.
Thank you, Sabrina. I appreciate it. And I know we're starting to run out of time. Try to get through a few more of these. Yes, Wallace, who asked, is Qigong virtual? Yes, they are virtual options. So please give me a call. We can set you up with using our VA virtual platform. And let's see. Do you need a referral to see a specialist? Such as orthopedics. So yeah, usually talking with your primary care provider is that first step in making sure that you can get that referral for any of the specialists. So again, always talk with primary care with that. And let's see. Sorry, we're starting to get a bunch more coming in. Okay, so we have Lisa, currently a veteran with care at Albany. I'm a massage therapist. How long will it be until we are able to offer massage therapy for both women and men and have these services for our veterans at these locations? So as I understand it, we are in development of building back our pain management services, and that includes massage therapy, chiropractor, yoga, and also acupuncture. And so that is in process, and that is the intent to bring massage therapy certainly back into our VA. So I'm sorry I don't have an exact time frame, but we are certainly making continued efforts to bring that back in. Okay, so we are at the hour today, and again, I apologize. I know we didn't get to all of the questions. Please give me a call at 518-626-5519, or if you'd like to email me, my number or my email address is emily.disalvo, DISALVO @va.gov, if you'd like to email me any of your questions. Again, we're at the end of our live event tonight, and I thank you so much for joining us in this public forum. We appreciate the opportunity to speak with you directly and answer some of your questions. Again, please call me if we did not get to your question and you'd like to talk with me. I'm happy to do so. We will host more of these events in the future to keep you informed on what we are working on and other important updates. So thank you for your service and have a wonderful evening. Thank you, everyone.